Hi, I'm Dr. Jennifer Schramm, and I'm a pediatric cardiac intensivist here at Johns Hopkins. And today I'll be talking about some exciting research we have using machine learning to uncover the risk factors for the development of necrotizing enterocolitis in neonates with congenital heart disease. To start, congenital heart disease is the #1 birth defect in the United States and affects 1 out of 100 live births in the U.S. every single year. Neonates with congenital heart disease are high risk for a complication called necrotizing enterocolitis, or NEC, which is a complex inflammatory and infectious process in the small and large intestines of neonates. NEC is very well studied in premature infants, but research in neonates with congenital heart disease and NEC is less well resourced. However, neonates with congenital heart disease and NEC incur triple the hospital length of stay, double the cost of inpatient admission, and have a high mortality rate. So to understand this problem, we first must understand who gets the disease. First, we start with the information source, which for my field is the Pediatric Cardiac Critical Care Consortium, a 70-institution collaboration project with both research and QI initiatives. Every single admission to the Pediatric Cardiac Intensive Care Unit are added to this database with more than 300 fields added per patient. Second, our methods. We chose machine learning because it is able to take thousands of data points, synthesize it like a human brain, and give you risk factors that are the most important. We specifically chose XGBoost, which is similar to a random forest classifier, which more people have heard of. So with our model, we identified 12 risk factors that predicted necrotizing enterocolitis development within 72 hours, with an AUC of 0.8 and calibration of 0.94. These factors provide a phenotype of high-risk neonates that includes those with a higher surgical complexity, smaller weight and age at surgery, and those most critically ill postoperatively. Feeding, a known risk factor for NEC in premature infants, was also related, although only preoperative feeding, not postoperative. However, there's a problem. Many of the risk factors we identified are not modifiable. I cannot change the stat category. I cannot change a neonate's diagnosis or how long their cross-clamp time is. So what do? We turn to something like neural networks. Neural networks are a deep learning type of machine learning that allows the user to model counterfactual scenarios to understand how manipulation of risk factors that are modifiable change the risk of NEC for an individual patient, similar to a randomized control trial, but with modeling. For instance, I have a neonate with hypoplastic left heart syndrome who underwent their Norwood and is critically ill postoperatively. I can't change any of those things immediately. However, what if I fed that neonate before their operation? Would their risk of NEC postoperatively change? What if I made them NPO preoperatively? How would their risk of NEC change then? This is our next stage in analysis. Massive thank you belongs to my mentors, Dr. Alan Everett, Mela Bembeya, and Cedric Malliot, my partners in the PCICU, and the patients who inspire this work every day. I appreciate the opportunity to share this with you, and I look forward to sharing more in the future.